Hello, my name is Lisa Deaton, and I am a Louisiana Nurses Political Action Committee contributor and volunteer. As a nonpartisan organization, LANPAC is conducting interviews with candidates for our state legislature. We want to learn more about where the candidates stand on issues that are important to nurses and to the health and welfare of the citizens of our state. LANPAC solicited input from nurses across our state, and then the Board of Trustees finalized the questions based on the top issues submitted. These questions were sent to the candidates prior to their interview. I'm delighted to welcome Representative Kyle Green Jr., who is running for re-election as state representative for District 83. Welcome, Representative Green.
Thank you.
I would like to turn it over to you now for some opening remarks before we head into the questions.
Well, thank you, Lisa, for having me, and to the membership of the Louisiana Nurses Association for giving me an opportunity to speak with you. This last 4 years have been pretty trying. If you'd have told me at the beginning of my term that we would have had to have undergone or survived a global pandemic and 3 major hurricanes in a 4-year period, and now it appears to be a homeowners insurance crisis. I told you you were kidding, but but we've made significant strides over the last 4 years. So I look forward to our time together, so I can explain to you, my positions over the past term and how I seek to govern over the next 4 years should I be reelected.
Okay. Well, the first question has to do with healthcare disparities. As we know, prior to COVID-19, we recognized that healthcare services are not accessible on an equitable basis. And since COVID-19, it was even highlighted to a greater degree. We know, though, that healthcare is only about 20% of what accounts for our health status. And it is the social determinants of health that are non-medical factors that influence our health. What strategies do you have to assist in reducing the social determinants of health's impact on the citizens of Louisiana?
So a couple of things. Number one, I don't at all pretend to be an expert in the medical field. I am an attorney by trade. So over the past 4 years, how I have attempted to govern myself when faced with decisions, I would rely on the opinions of the experts in that field. So, should I be reelected, I would weigh heavily my decision making on those who are in the medical field. But having gone through COVID-19 and having had a district that was hard hit by COVID-19, I can tell you that it definitely exposed what we already knew, that people of color, were at a disproportionate higher risk of suffering from that virus because, number one, they lacked access to quality food, and receiving a well-balanced and nutritional diet. Secondly, we knew that, in terms of healthcare, that many people who were in poor neighborhoods and those who were persons of color lacked access to quality, affordable healthcare. And also with the healthcare, that there wasn't necessarily an emphasis on preventative care. It was, you typically would go to the doctor when something flared up, as opposed to having routine checkups. And so those are types of things that I think that we have been, kind of pulled the veil over and exposed. And I think now you're seeing concerted efforts to address, those particular areas so that we don't have a repeat of what we saw, 2 and 3 years ago.
Okay. Our next question has to do with faculty shortage in education. How would you advocate for federal and state funding to support recruitment and retention of our nursing faculty to reduce the nursing shortage?
Well, I would work hand in hand with our members of Congress, our congressional delegation, and also I work with those administrators in our teaching facilities across the state to see how we could help create an environment to where we would want to educate nurses, but also keep them here um, to provide the much needed healthcare services to our state.
Okay. Moving on to safety and violence. Gun violence continues to roar through our communities. It happens in schools, houses of worship, shopping malls, just about anywhere that we go. What factors do you see as critical to bringing an end to these senseless acts? And do you have any strategies on how to address the problem?
I think number one, it's a cultural issue that we have, a culture of violence that we need to pull up by the roots. The second thing is we need to make sure that we're doing everything we possibly can to ensure that guns and weapons of mass destruction or military style weapons are not in the hands of its own an assault styled weapon. We're not going to war. You don't need it to hunt, and you don't need it for to protect yourself or your property. So, I think at bare minimum, in terms of the proliferation of weapons in our society, we should make sure that everybody who owns a gun has a background check. And that's not something that's unreasonable. That's a couple of things that I think we can do to try to turn the tide on this culture of gun violence that has kind of run rampant across our country.
Okay. Rapid fentanyl test strips can be used to determine if drugs have been mixed or cut with fentanyl. With important information about fentanyl, healthcare providers can take steps to reduce the community risk of overdose. How would you support legislation to make rapid fentanyl strips more readily available?
I think it's simply investing in it, making it available to any and everyone. So, look, I'm not, and I don't think for one second that making fentanyl test strips is giving an acknowledgement to the behavior of taking illicit drugs. But, you know, if you're going to do it, then by all means, you need to make sure that the drug that you're taking is not laced with fentanyl because it can lead to a much more serious medical condition. So, I would support any effort in the legislature to expand, the use of fentanyl test strips.
Okay. Then we'll move into access to care. Are you supportive of actions to remove arbitrary barriers that prevent all healthcare practitioners, including advanced practice registered nurses, from practicing to the full extent of their licensure, education, and training?
I am. Louisiana is a very poor state, and we're either urban or we're rural. And in many cases, those in rural communities, will have to travel many, many miles to seek a healthcare provider. In many cases, they're not even seeing a MD; they're seeing a nurse practitioner. And I think it's vital you know to sustaining a healthy society that we allow those in the healthcare. Well, we allow our citizens to have as much access to healthcare as we possibly can. And so I generally have been supportive of the efforts to allow, particularly nurse practitioners to practice, in whatever capacity that they choose to practice in.
Okay. Our next two questions are more of a general nature. The first one is, what are your legislative priorities?
Okay. Well, my legislative priorities. Number one, I think we have to because where I live in the Greater New Orleans metropolitan area, particularly Jefferson Parish, the city of Marrero, we have an issue of the homeowners insurance crisis that we're currently dealing with. And if that is not addressed, it's going to create a housing situation because many people who own a home are not going to be able to afford the homeowners insurance premiums and could be priced out of owning their home and living in their home. So that's a priority. The second priority is dealing with crime. We've seen a rash of crime in our area, and I think we need to deal with that, but deal with it in a more holistic way. Uh, as opposed to the old mantra of being tough on crime. I don't think we can jail and arrest our way out of the crime situation that we have. I think we need to look at the root causes of why crime occurs in the first place. Another area is dealing with infrastructure, making sure that we have an infrastructure that meets the needs of our people, particularly in my district. I would want to see more investments in that. And also in the education realm. I was fortunate enough to pass House Bill 282, which expanded, uh, the free lunch program to include reduced children. That was signed into law by Governor John Bell Edwards. Now it's Act 305. So, I would like to see continued investments in health, in education, particularly also in early childhood education.
Okay. And our last question is, why should Louisiana nursing community support you as the best candidate for the legislature for District 83?
Well, I'm never one to say that I'm the best candidate. I'm going to let the voters decide on that one. All I can do is just lay out my record. And I think my record, being the incumbent over the last 4 years, kind of speaks for itself. I supported, and I was served as a co-sponsor, to give, you know, the federal dollars that we received as a state to make sure that we took care of our frontline workers who were on the front lines day in and day out, saving lives during the pandemic. And I have always or generally supported, you know, expanding access to healthcare to all parts of the state, allowing nurse practitioners to practice in different areas. So, that along with my record, I think it speaks for itself. And so that's why, I would ask for your support and continue the partnership that we have had over the last 4 years to continue for the next 4 years.
Okay. Well, Representative Green, we would really like to thank you for taking the time out of your busy schedule. But before we go, we'd like to give you a couple of minutes for any closing remarks you would like to make.
Well, thank you for the work that you all have done in the Capitol and in educating members. And I always have enjoyed our conversations because, like I said, I am not an expert in the healthcare industry. I'm a lawyer by trade. And so, it's vitally important that we have reputable organizations that who have earned the respect of legislators to articulate their members' positions on behalf of their membership. And so you allow us to make informed decisions. So, I look forward to continuing that relationship, in the next term and anything that I can do for this organization or its members. If there's a particular bill of interest in the next term, please do not hesitate to reach out to me. I pride myself on being extremely accessible to anyone who wishes to speak to me about any particular issue. So once again, thank you for your time.
And thank you. And we wish you the best of luck in your reelection campaign.
Thank you, Lisa.